Now, let's talk a little bit about some men's health. What are some other things that we should do, maybe even as adults too, because we've talked about mammograms, we've talked a little bit about pap smears. What are some other screenings that adults need to have in general?
For adults, especially with the epidemic of obesity that we're having, I do think it is important that our patients routinely screen for cholesterol. And that screening schedule, I think, would be best discussed with your physician, because depending on your medical history and your age and your risk factors, that is something that would help us determine how often we would screen for something like that.
And that's a simple blood test that would be ordered, and then you talk about your other risk factors and look at that into account with your lifestyle, like we were talking about, and then also what those numbers are. What are some other numbers we need to know? Blood pressure?
Yes, blood pressure is something else that we could screen for, and that should be done routinely. Whenever you go see your physician, they will always check a blood pressure on you.
And look at your family history then again, too, of high blood pressure, or the term that we've heard before, too, hypertension. What about a colonoscopy? That's something we're seeing a little bit in the media, and encouraging everybody to have a colonoscopy. Tell us a little bit about that procedure and maybe what age that should start.
Colon cancer is also another very important screening, and that usually starts at the age of 50. It can start earlier depending on your family history, especially if there is a family history of colon cancer. And
that's usually just recommended then by the physician, and family practitioners don't necessarily perform that, but that's something that you discuss and then look at referring on to the physician that might necessarily need to actually do the test as far as the colonoscopy is actually concerned, correct?
Yes, and even if you are over 50 and you have not had your colon cancer screening, I do recommend that you talk to your physician, because even if you're not on time with that, it's still important to do.
Dr. Watson, I just actually thought of another one too. What about bone density in women? We hear a lot about making sure we have our calcium, so what should we do with bone testing?
With bone testing, that's a tool used to rule in or out osteoporosis, which is fragile bones, which then can cause increased risk of fractures. So we want to reduce fractures, especially in elderly women. So that testing should be performed in women of age groups, excuse me, greater than 65 years of age. If you have risk factors, it may need to be done sooner. Risk factors usually are, of course, females, postmenopausal, smokers,
small frames,
small, thin women. These are risk factors, and if you have those, you may need testing before age 65.
We've been talking about preventative care for men and women. Dr. Green, tell us a little bit about preventative care maybe for children and adolescents. I think sometimes we think about going to the doctor as adults when we're ill, and so we really wanted to stress that it's important to have that partnership again and make sure that you're going for the preventative care. But children and adolescents need to be seen regularly by their physicians too, and especially family practitioners.
Yes, absolutely. And I think for children and our adolescents, it is important to make sure that their vaccination schedule is up to date. And recently they've come out with a new HPV vaccine, which is recommended for both women and men. And that's something I would recommend that you discuss with your physician to see if it would be appropriate.
To actually go ahead and have the series, correct? They start on that. Now, children, though, need to make sure that they're having their immunizations, obviously, as they're going into school. But it's important to kind of chart their growth, correct? And make sure that they're growing healthy and making sure that they you're looking for potential, making sure they're healthy, making sure you're looking for potential disease processes that might show up too, based upon family history and everything too, correct?
Yes, correct. And every time we do see a child, we always monitor their growth and their height. And obesity is something that we do need to look for, especially with the epidemic that we're having.
That's true. We've been talking about preventative care for men, women, children, and also adolescents. And stressing the importance of the partnership that they need to have. As they're preparing to come to the doctor's office, it's a good idea maybe to keep a journal, to have your medical records available so that you can see what's been going on in the past, or as they're establishing maybe a new relationship with the physicians, it's important to share a lot of their personal and their family history information. What are some other things that they can bring to the visit in preparation for you to work with them?
I think if it is the first visit and you're meeting your physician for the first time, if you have old records to review, that would be helpful, because there's a lot of history that a patient can tell you, but you can see a lot more through another physician's records and typical treatments that they've had, what has worked for you in the past and what hasn't, and that will kind of help guide us in your treatment.
What about medicines maybe that they may be taking, so you have a little bit of information as far as the dosage and the type of medication that they take? Allergies, anything that you might need to know there?
Absolutely, and going back to the medication, I do think it's important that when you see your physician for the first time to actually bring those medicine bottles in, because there are a lot of medicines that do look alike and can be easily confused, so that will kind of help us make sure that our records are accurate and that we are not.
And remember the dosage. That's a very difficult thing that, you know, a lot of times you think, well, I take a pill, but there's a lot of different strengths in a pill. So actually going ahead and bringing it to the office, then you're able to actually look at the spelling, because as you were saying too, there's a lot of similarities, so that way you're able to avoid any of that. And of course, then again, partnering with your pharmacist is important too, so you make sure you're going to the same physician. That's something. Now, we've been talking about what you can do when you're in the office. After they leave the office, what's important, Dr. Watson?
After they leave the office, it's important that they understand what's been spoken about between the physician and the patient. Make sure there's understanding about new medications that may have been prescribed, about any conditions or illnesses that may have been diagnosed. If a patient doesn't understand what's been said or how they've been treated within that visit, then they're likely to not be compliant when they're home, because simply just misunderstanding or just not understanding at all. So for one thing is it needs to be a good understanding of what went on. Yes,
it's important to clarify, I think, and I know, you know, sometimes as the patient, you think you hear something, you're not quite sure, and it's a lot to absorb.
Exactly.
So, you know, maybe even jotting it down, and I know, you know, physicians' offices are really working to make sure that they're leaving with some instructions.
Exactly.
And then it's important then to follow up with that. I mean, if you want to be healthier, you have to take an active role and be responsible for your own actions and your own health. Exactly. So you leave, and hopefully then you use the word compliant. That really means taking that responsibility. And then if you make a follow-up appointment, how important is that?
Oh, it's important to follow up. For a physician, we want to make sure the patient's getting better. If we give them some medication for the blood pressure, we want to make sure the blood pressure is coming down, that they're compliant with the medication, and that they hadn't had any side effects from the medications. Sometimes patients will continue to take medications even though you know, they have side effects. And if that's the case, we always tell patients to stop the medication and to call the physician. It's better to do no harm than to go on and keep treating.
Right.
With
and
adverse
that's
side
a very
effects.
good point. I think if you're starting a new medication and you're working to see what's going to be best for you, keeping your physicians obviously informed and making sure that, you know, I'm not feeling exactly right, calling them right away and then seeing if, you know, something else might work. But, you know, don't stop it and do nothing. You definitely need to make sure you call and contact so that you can get something to help you out and feel better and enhance your well-being instead of not feeling good.
Exactly.
And you want to have a good quality of life. You've brought up some very good points, I think, for our viewers today, and making sure that we look at a lot of preventative medicine and not necessarily just going to see the doctor when we're not feeling well. That's important too, but it's also important to have that preventative care and make sure that we're avoiding something maybe down the road. Any other tips you'd like to share with our viewers as we wrap up this session?
As Dr. Watson said earlier, I do think that open communication between your physician is important, and you do need to be able to go to someone that you trust and that you feel comfortable with, because that will help ensure that you do get good health care.
Absolutely. I think that's very important, that you feel comfortable with who is taking care of you, and then you're establishing pretty much a lifelong relationship, aren't you?
Very true.
And we've been talking especially about the family and making sure that you're looking at the whole picture and the whole person. We've been saying too, whether it be psychosocial or mental things that are going on and stressors that happen in our life, and that's a big one. As we all know, if we're stressed, a lot of illnesses can show up, and we're not sleeping well, and we catch cold easier, you know, with our immune system. So really looking at the whole picture, and we appreciate you taking this time out of your busy schedules to share this information with us.
Thank
you so much.
Thank you.
Well, we hope you tune in next month for another edition of Health in the Heartland. For more information, please visit our website at www.hmh.net.